the UK. The UK is facing a very big shortage of healthcare workers currently because of the industrial action which was taken by nurses and doctors because they were complaining something about their salaries being not at par with the other colleagues in other Western countries. So in this video, I want to tell you about this UK healthcare agency which is hiring internationally, and that is for care assistant, domiciliary workers, and those healthcare jobs which most people deem to be in the UK, they deem them not to be good, but those are jobs. Once you compare the salary with the salary of someone who is working in maybe the developing world, maybe in Africa or Asia, you find that £10 per hour or 21,000 pounds per year is good money compared to some salaries for health workers, even for some nurses in some countries. So in this video, I will just touch a few things. What these mostly the domiciliary worker, what it involves, the responsibilities you take, and the requirements for someone who is applying for these jobs internationally, because most of my videos are for international applicants for these jobs. So I will be touching things related to those things. So what specifically does a domiciliary worker do? And these are people who are involved in mostly they help nurses, and currently, because the UK is facing a very big shortage, the domiciliary workers work at home, the client's home, and they help these clients with the activities of daily living. They help them with showering, changing clothes, changing diapers, something like dietary support, whereby you help them. You might even be involved in cooking for the patient. That is what generally is called meal support or dietary support. There are things you might be involved in doing laundry for these clients, because you find that these are clients maybe who are not able to wash their own clothes, but you are supposed to wash their clothes maybe using washing machines and other supporting equipment. You might also find yourself helping these clients with shopping, because these are clients who need maybe support in each and everything. So, and they are not able to make decisions on buying decisions, so to speak. So you might find yourself going or wheeling the client, driving the client to the supermarket or retail store or supermarket to purchase equipment. The other thing is basically what we call mobility support. Once you get to UK and start working mostly as a domiciliary worker, you'll be helping these clients with their mobility, moving from one point to another. That is what basically is called wheeling. I think you've seen maybe in videos whereby you see healthcare workers using something which looks like wheelchairs to help these clients move around. Maybe they are not able to walk, so you assist them in that way. Those people who are walking using walkers, you also help them to move from one point to the other. You might find that the clients are clients with their special needs, and by special needs, you might find someone has dementia, someone has if it's a child might be having Parkinson's disease, and also clients might be having what we call post-surgery issues. Maybe someone has gone for a surgery and is recuperating at home, and through that they need support from someone who is called a domiciliary worker. What are the requirements? I'm just trying to brush through, because I want to show you this UK healthcare agency which is hiring for these positions. So bear with me as I rush through, so that I give you the overview and you understand what you need so that you apply for this job. Don't forget to give this video a thumbs up, because that is what helps the channel to grow far. And thumbs up is just tapping the like. And I told you in another video, you'll get good colors once you tap that thing. You can also ask questions in the comment section, and maybe if you are watching on live or you are watching later on, you can ask questions and I'll be answering them on the go. So what are the requirements? What are the requirements for you to get these domiciliary worker or care assistant worker jobs from abroad? Because most people are looking for these jobs from abroad. One, you'll need what we call health and social care training. And I told you, this is training you can either get from a local college from your country, or if you're not able to get somewhere to do that kind of course, because I know even some people are not able to get the time to do this course physically, you can opt to get this course done online from what we call Florence Academy or Allison. You can just go there and search for what the courses in healthcare. Mostly they are called 15 Foundations of Care, but most employers require you to have like 3 or 4 courses. But if you do them, the 15 of them, Foundations of Care, you'll be they're basically course related with the patient safety, how to deal with patient. Nothing much. It's just that you need some even patient positioning. Those are things you need to know, and basically that is what the 15 Foundations of Care courses involves. The other thing, as an international applicant, you'll need to know that you need an English proficiency exam. And in this case, the one which is accessible to most of our people is what we call IELTS, and this is done from a British Council. Some employers might require you to do IELTS General, others might require you to do UKVI, IELTS UKVI, and the cost is not some small amount of money for people. I know it's a challenge. That is like $300 US. It varies from country to country, but basically it is somewhere along that amount of money. That is $300 US or thereabouts. For people who are watching from Kenya, that is like 29 or 30,000 Kenya shillings. You might get an extra cost of maybe looking for someone to train you, which again is a cost on your side. The band score you'll need is a band score of 4. That is the minimum. But if you can get a band score above 4 or 4, 5, 6, the better, because some employers might require you to have a band score of maybe 5 or 6 in the IELTS or what we call IELTS UKVI General. The other thing, don't forget that the driver's license is very important. The driver's license in this job, mostly the agency jobs, because you might find that you are working with clients who are in different locations. Maybe you are working with one client in the morning, and in the evening you are working with another client. So a driver's license is very vital, very important. And I told you, most of these agencies will even help you to secure a vehicle, which will help you to move. If they don't have that plan, what they do is that they have what we call a car sharing policy, whereby you and like 5 or 4 other domiciliary or care assistants, you are assigned, you are sharing one vehicle, and you are being reimbursed the fee, the amount of money you are using to commute from one place to another in terms of per hour or kilometers. It's calculated per hour or per kilometer, so to speak. And about the driver's license, from your home country, you can go to the UK with your driver's license from your home country. You should be able to drive with it for like 1 year. If you're not able to, if you are able, you can get what we call an international driver's license. I know it's it's available in different countries. Go ahead and research and see which one is available in your home country. For people who are watching from the 254, that is Kenya, there is what we call a driving school. That is where you can get the 15, not the 15, where you can get the driver's license. That is the international driver's license. The other thing, don't forget that the police clearance certificate is very, very important. And in the UK, they usually call it DBS check. But you can get a police clearance certificate from your home country or the country you've lived for more than 6 months. Make sure that you have that police clearance, and it doesn't have any criminal aspects in it. The other thing to think about is the salary. What is the salary for care assistant or domiciliary workers? The salary range is around 21,000 British pounds per year. So you can calculate that, divide by maybe 12 months, and you'll know that how much that that is in your home country. And basically, it's not less than 10 British pounds per hour. So if you're working for 39 to 40 hours per week, you can do your own math and know that is maybe 40 hours multiplied by 11 British pounds, and you will know the amount of money that is in per month. But there is what we call shift differential. If you're working what we call an abnormal shift, maybe the weekends, nights. If you're working with an agency, they might have what we call shift differential, whereby you are paid maybe time and a half. Maybe your salary is 10 pounds per hour. The half is 5, so that will be 15 pounds per hour if you are working what we call unusual shift. There's also what we call when there's an abrupt shift change. Maybe you are told to extend a shift maybe by 3 hours because they are not able to get someone to fill the position or someone to come to work at that time. They will pay you even more, even double sometimes. And that if you are earning like 11, that will be 22 British pounds per hour. That is it about the things I wanted to tell you. Those are the requirements. Make sure that you get them from your home country. Recruiters are recruiting, and care assistants, senior care assistant, domiciliary workers were some of them were added in the shortage occupation list. Mostly the senior care assistant. So you will not need to pay what we call the health surcharge. And that is because people who are working in the healthcare field, they are entitled to not paying healthcare surcharge. It's like insurance for healthcare. But people who are working in the healthcare field, mostly doctors, nurses, senior care assistant. I don't know so much about domiciliary care workers. I will check that. But you will get what we call a waiver in terms of health surcharge, which is costly for most international applicants for these jobs. That is it about the things I want to tell you about the requirements. I want to show you this care agency which is hiring, because I know people are searching for jobs day in, day out, and that is why I want to show you this agency. So bear with me as I take you through this agency in a very short video. I want to minimize my screen so that you'll be able to see this website. I'll share the websites in the description of this video so that you can later on go and check for yourself. So the agency is called Academic Care, and the website is academiccare.co.uk. If I take some time before I update the description, the website is academiccare.co.uk. Then you can go to the jobs tabs you are seeing here. Then once you come here, you need to come to where you see international recruitment. Just select that where it is international. Maybe you are in the home page. Let me take you to the home page, for example, so that you don't get it. You see here people basically work in client's home, but you just need to come here and select international recruitment, because most of our people are applying from outside the UK. So you need to go through the international recruitment. If you are someone who is already in the UK as a student, you can also use the UK recruitment, whereby that is suitable for people who are students and you need maybe sponsorship to work in the UK. So as you can see, you can come here and read all this information. We are not going to read all that. Let me take you step by step the hiring process. And it starts by filling this application form. You just need to come here, stage 1. You click this application form. It will take you to another page. Let me hope so. It will take you to another page where you fill all your details. Let me bring it so that you see. Yeah, that one. The one you're seeing right now. That is what you need to fill. Fill all your information, including your name, your date of birth, address, city, phone number, and driver's license. That is why I told you you'll need a driver's license, because it's very essential in these jobs. So what is the other thing? What is the next step? Step 2 is you get an interview, because this company will give you an interview through Microsoft Teams, as they have written here. They'll call you, then they will interview you. Prepare the common questions. There are common questions for domiciliary and senior care assistant jobs, and I'll do another video. So be sure to subscribe to this channel, because I'll do another video with the questions you will expect if you are looking for jobs in care homes. The next step after the interview is compliance standards. These are basically things which are you need. This is basically compliance paperwork, including professional references, internal documents, and home office standards. Those are things you need to certify. Those are the things which include even the English proficiency exam. Have you been trained somewhere? Do you have some certificate? But domiciliary workers, they do not need any kind of certificate apart from what I've told you, which will give you an upper hand in the recruitment process. Stage 4 is a visa application, and this is done from your home country. Some employers help you with the payment for this visa application, because it's not cheap. It can go up to around 600 British pounds. Depends with your home country and the visa you are looking for, you're applying for. So it can go all the way to 600 pounds. So it's not cheap. Some employers might offer to pay this for you, and some of these payments they make is money you need to refund them after you start earning in the UK. So the stage 4 is visa application, which basically takes like 2 or 3 months before it's approved. So make sure that you apply for these things early, so that it doesn't delay so much. The other thing, after your visa is approved, which is stage 5, you need to book a flight to the UK from your home country. Stage 6 is induction week. They do an induction whereby they train you on what they expect of you, and basically that is what they do once you arrive in the UK. Stage 7 is when you begin your placement. That is when you start working. But all this time, once you get in the UK, your salary starts counting at that point. So basically, that is what you need to know about these jobs. Just go ahead and fill that form, whereby this is for international applicants, because that is what will get you an interview, because these employers are always looking for workers. Don't forget, these are employers and at this point, they are looking for many healthcare workers, because of the shortage we know is happening in the UK. They are not able to fill positions because of nurses exiting. There's a what we call an increased staff turnover. That is where nurses are exiting to other countries because of the perceived low pay for nurses and other healthcare workers in the UK. So apply for this job. Apply to this care home, and I'll be sharing other care homes which are hiring. Don't forget to ask questions in the comments section, because that is where I will answer all the questions. Where's the link? Apply. I'm a certified nursing assistant. That is Alicia. Alicia, I will share the link with you. If you're still there, you can see it in the comment section. I've already shared with you. Those people who are watching on later on, it's on the screen right now. You can enlarge your screen or hold it and type this on your screen, so that you get to understand, or you get to know what are the requirements to apply for this job. Nagugu is asking, hello Jackson, hope you are well. I hope that I wanted to contact you for resume making. Please check my. I will share my number in the description of this video, so that later on you can contact me through WhatsApp if you are in another country, and I will help you with that. So thank you very much for being with me. Don't forget to like this video and watch another video in this channel, because I'll be doing very many videos about healthcare workers and other cadres in the UK, in the job market in the UK. Thank you.